our co-leads in protocol order. The co-leads who have been working very closely with us to get this initiative off the ground and to reach out to partners. And I'm delighted to start with France. France has been the strongest voice in the call for action for vaccine 10 days ago with the World Health Organization. For France, Président Emmanuel Macron. Emmanuel, tu as la parole.
Merci beaucoup.
Thank you, dear Ursula, President of the European Commission, President of the Council, Secretary General of the United Nations, colleagues, ladies and gentlemen, heads of state and government, Director General of the WHO, ladies and gentlemen. On the 26th of March, the G20 leaders committed themselves to an international response to the COVID-19 pandemic, a response that would be massive, coordinated, and one of solidarity. And we've just heard that from Ursula. Now, on the 23rd of April, with the WHO, with all global partners brought together in record time with agreed principles, whether we're talking about states, foundations, private foundations, etc., we have launched an initiative to accelerate the creation of the means for preventing, detecting and treating, to guarantee equitable access to the means to combat the pandemic, and also to consolidate our health care systems to combat COVID-19 in the most fragile countries, and to pursue, of course, combating and controlling other diseases. I'm thinking, of course, of Africa in particular. The third pillar is vital. We have to step up the efforts to strengthen healthcare systems. It's a historical initiative. And I think that this conference today, organised by the European Union, is extremely important. Thank you, President. We want to draw all the lessons we possibly can from the past and past pandemics and their management, what's worked, what hasn't worked. With COVID-19, it is legitimate to say that it is for states to protect their populations, find answers, but we will not deal with this once and for all, except together. And that's what the initiative is designed to achieve. So we want collaboration between states, between vertical organizations, between foundations, but also private stakeholders in the pharmaceuticals sphere. So we want to focus on research, treatment, vaccine, although we know it's going to take time. And that's why at the heart of this initiative there is a decision we have to all take and support. When the vaccine is ready, it has to be a public good, a worldwide public good. It has to belong to us all. Of course, those who bring it about, who invent it, will be duly remunerated, but access will be given worldwide via the organizations selected and sound public and private structures that we will put behind this. The initiative, of course, needs to be financed, and we are there to play our part. Thank you, President of the Commission, for playing this part, which shows the will of Europe to live up to expectation. We want to step up this work to save lives, to end the uncertainty of this crisis, and to begin the reconstruction that will be necessary economically and socially in the aftermath. So we have to cooperate to ensure that we have the means to achieve this. We, for France, will take up our responsibilities. We need a WHO to deal with crises such as this. We need to consolidate its role in terms of warning and coordination, and we will step up our support to the WHO over the next 2 years. We need, as I've said, to accelerate work on the vaccine, which will be accessible to everyone, and because we have essential work to carry out on equitable access to therapeutics and diagnostics, and in terms of patents in particular, nothing will be possible on diagnostics therapeutics and vaccines unless we support healthcare systems. Now, for all these reasons, 500 extra million euros will be committed by France in the ACTA initiative context, and this will be fully aligned with financing provided elsewhere in the Santé en commun, or Health in Common initiative, which is 1.2 billion worth and is being spent by our national stakeholder, supporting NGOs and research organisations internationally. We want to help our African partners in particular to shore up their health systems. Commission President, you've said it would be a long path, and it will be. We need the vaccines and therapeutics, but we need them in massive quantities, and we need to distribute them. And therefore, I would call on everyone to work towards that goal, and I can assure you we are committed.
Monsieur le Président, merci Emmanuel pour tout ce soutien à cette noble cause. And now we go from Paris